All right, good afternoon, folks, or early evening, whichever way you want to call that. My name's Jordan Sheff. I'm the commissioner here at the Department of Developmental Services, and I thank you for joining us on one of our question and answer sessions. This is the 5th of 6. The last one, I believe, is tomorrow evening at about the same time. And I look forward to wrapping these up, and we may consider doing additional opportunities like this going forward. Before we get into the substance of today's call, I wanted to state remind folks, hopefully you've had a chance to watch the videos that were prepared ahead of these meetings, just to sort of bring you up to speed on the transformative change we started talking about last fall that we're working on currently, particularly where America Rescue Plan Act money is in play, ARPA funding. But I wanted to, before we get into some more of that, take a few minutes. We've had a lot of changes since last fall, since the last time I visited with some of you. So I wanted to first acknowledge Deputy Commissioner Elisa Velardo is on the call tonight. And she'll have an opportunity to introduce herself a little bit more in a moment. But we also have new regional leadership, and we're fortunate tonight to have two of our regional directors. I will start with Cress Secaroli, recently appointed regional director here in the South region. Cress.
Good afternoon, everybody, or pre-evening. It's nice to meet all of you. As Jordan noted, I was appointed to support the South region as the regional director this last July. We also have some other new appointees in the South region. Brian Smith has joined us from the West region. So Brian is part of the administrative team here in the South region, and like myself, is getting reacquainted with the South region. We feel very, very happy to be here in the South region. That's a little bit of a homecoming for me. I, did a good part of my career in the South region. So I'm very excited to be here to continue to meet families, providers, and the employees that support all those that we support in the South region. So thank you.
Thank you, Cress. And taking over in public, we have with us tonight Regional Director Patricia West. Patricia, are you still on?
I'm here.
There you are.
Hi. Good evening, everyone. As the Commissioner said, I'm Patricia West, the new Regional Director for Public. I too started just in the summer, the same time as Cress did. I've spent about 33 years in the field working with individuals with disabilities. This is a true joy and pleasure to be in the position that I've just been assigned to. And I'd like to say that Ann Kimball is the new Assistant Regional Director. She too is on the call today. So it's a pleasure meeting everybody, and I look forward to talking to you in the future.
Thank you, Patricia. There are a few other names. I don't, if they are on tonight, you can unmute yourself and say hi real quick, but I don't believe they are. So we made 3 other important hires. We made lots of important hires, 3 other additional important hires last year in a newly created Office of Diversity, Equity, and Inclusion to help us manage both internal and external issues in that domain. We hired Dr. Cheryl Ellis. I don't think she's on the call tonight. But if she is, she'll come on and say hi in a moment. A lesson learned from the pandemic. Other agencies have someone in charge of specifically this type of emergency management. And we have hired Mr. Jake Mankey, who took on that role in the last 6 months or so. And lastly, and I believe she is on the call, we, after many year tenure for Mr. Edman Bruno, we hired Shannon Giacovino as ombudsperson for the department. And Shannon, are you on tonight?
Shannon's not on.
She's not. It's an over kind of evening for me. That's all right. I appreciate those who did make the call this evening. So just a couple other quick notes before turning it over to Elisa and trying to keep this rolling for y'all. As I said, we We met last year and used the feedback from these types of sessions to inform the 5-year plan in 2021. Workforce has been a constant issue through the pandemic and even more intensely since the pandemic started to wane some. And we are utilizing some ARPA funding to help transform the system and stabilize staffing and providers. I just want to make sure that people, there's one lesson that seems to be attributed, or one set of phrases that seems to be attributed to me. And I just want to sort of set the stage. While this transformative work hopes to fill spaces in our continuum of supports, its intent is not to eliminate or replace group homes. It is not intended to eliminate staff people from the equation. These are the technology and additional living situations, shared living and mixed use affordable housing are all intended to add to the types of supports and services individuals with intellectual disability can get through the department, and not to eliminate services from the range of services we have currently. So with all that, and with that, feel free to ask questions as you go along, but before we move into the question and answer section, I do want to now turn it over to Deputy Commissioner Elisa Velardo.
Thank you, Commissioner. Hello, everyone. I'm Elisa Velardo, Deputy Commissioner of DDS. Prior to my role as Deputy Commissioner, which began in April of this year, I was the Regional Director for the North Region. And prior to that, I worked in the private sector, the private nonprofit community for about 25 years. It's really good to see everyone here today. And I just want to share some information. This builds on the information that was shared in those videos that accompanied the meeting invite. We've been hosting a series of forums each month. The fourth Tuesday forum on innovative services occurs from 3 to 4:30 each fourth Tuesday of the month. And we look at various topics along that continuum of support services that we think may be of interest to individuals, families, providers, and DDS staff. We began this forum in July, and we've had 3 topics so far: supportive housing, assistive technology, and individualized housing support options. Those, if you were not able to join us, those recordings are on our website. If you go to the homepage, you'll see under frequently used links, the fourth Tuesday forums. And if you click on that, you'll get the listing of forums and the recordings of those forums that have taken place. Some of the topics we have coming up for October: community companion homes, November, employment and specifically customized employment. In December, we'll look at remote supports. And the format is a little different from what you may be used to, different from this type of format. We'll give an overview. We have a DDS staff person or two that will give an overview of what that option is. But really, the key is to get different perspectives. And so we'll have providers that provide that service that will share information. And probably most importantly, we have individuals and families that are taking part in that service speak directly about what that service or that support option means to them. And I think that's really resonated with people. And I think that when you're seeing somebody demo the assistive technology in their apartment or share a little bit about what supportive housing looks like from their perspective and giving a tour of their home, it becomes much more real, and it's been pretty well received. I am looking at topics for the first half of 2023. So if there are topics that you would find helpful, please feel free to drop that in the chat or mention that. And we hope to keep this series going into the new year. And in the realm of employment, a lot of exciting things continue to happen. We continue to work closely with the State Employment Leadership Network, SELN. I talked a little bit about that in the video, but since that video came out, we did receive our third quarter recommendations from the subcommittees. So the commissioner's office is in the process of looking at those recommendations and will be providing feedback on those. We're also in the process of convening a subcommittee on transportation. One of the things that became clear as we looked at the original recommendations is we can talk a lot about employment, but unless people have a way to get back and forth, the conversation can stop right there. And so we are convening a subcommittee specifically around transportation. And if you have ideas on expanding transportation options, we know that the options are very different depending on where you live in the state. And if you have interest in participating on that subcommittee, you can reach out to Julie Bouchard, and she is gathering participants for that subcommittee. You will hear quite a bit about customized employment in the months ahead if you haven't already. Customized employment is a proven process for supporting individuals who want to work but have not yet been successful in finding employment. And it's a little bit more structured support that really has some great results. There is funding available for people who qualify. And so if you're interested in learning more about customized employment, we have some of our employment and day services team members on the call tonight. And you can contact your case manager for more information, and they'll work with our employment and day services team as well. And I think that's all I have for updates. So I'll turn it back to you now, Commissioner.
Thanks, Elisa. So with all the talk going on about transformation, with the workforce crisis in full effect, in the midst of everything else going on in the world, we wanted an opportunity to talk to people who would attend these types of meetings and have questions. So I'm going to open the floor up now for questions, and there's several ways you can go about that. If you're not familiar with Zoom, and I'm not that familiar with Zoom, if you hover your mouse or whatever you use as a mouse at the bottom of the screen, there should be a reactions icon, and if you hit that, there should be a raise hand function there. You can turn your camera on and wave vigorously, and our staff will notice, so you could actually just raise your hand. And if you're on phone tonight, I don't know that we have anybody, it's #6 to unmute if you've dialed in. And I think that's what I got. So with that, we'll take questions from the participants today. Gonna be quiet. Staff, providers, families, interested stakeholders, our friends from the ARC. CTFSN is on the call tonight too, our family support network.
Commissioner, I'm seeing that Kathy Verano applauded. I think she may have intended to raise her hand. But Kathy,
Well, I told her to wave
Oh my
vigorously.
gosh,
Maybe
I
that looked like
did.
applauding.
Although I would applaud, but I really did mean to raise my hand. And I don't really have a question as much as I have a suggestion, as Elisa had asked for suggestions on what to discuss in those meetings. And I think one of the presentations might want to center around how families go about purchasing a home or providing a home for their individual and seeking supports within that home. I see more and more families exploring that, and there's some hiccups in that process, because I think we find out as we go along what the process entails or what the rules are, and it frustrates people. So I think if we can give that information up front as people are giving consideration to future living situations, I think that would be helpful.
Appreciate that, Kathy. Elisa?
I think that's a great suggestion. And Kathy, I may reach out to you because if you know of some people that have successfully navigated that process, I'd be interested in talking with you and maybe featuring those stories.
Sure, I'd be glad to share that.
So do we have other calls, oh, I see Robin has her hand up, Joe.
that's correct, Commissioner Robin.
There we go.
Hi, can you hear me?
I can.
I was just wondering if you could resend those videos because I don't see them in the meeting invite that I received. Maybe I'm missing something. Were they sent in a separate email?
Kevin or Joe? You want to help with that? I didn't do this ending, so I don't know.
Sure, yeah, they're actually at the top of the email chain, or they're at the top of the web page that you used to sign up for this, but I'll share it again.
Oh.
It's actually right on the top section of helpful resources, DDS stakeholder update, but I will put that.
We'll
in
get
the-
them out to you now, Robin.
Yep. I'll
Thank
send it right now.
you.
Yep.
You're very welcome. It's confusing. It's confusing.
Next up, we have Kevin Merritt.
Kevin.
Can you hear me okay?
I can.
I'm a father of an autistic son. We participate in the Katie Beckett program, get a number of services from DDS, which are great. My question is, I guess it's a comment, a question. I'm sure you've heard from others, but it's been challenging working with agencies from a staffing availability point of view, to get folks to look after our kids. I'm wondering if the state, if DDS has considered either directly employing aides or just providing funds directly to families, basically de-emphasizing the role of the agencies in the process.
Thanks, Kevin. We do have programs where the individual can self-hire through self-determination, and through DSS and the Katie Beckett waiver, there may be that opportunity as well. We have not, we do not have intentions of directly hiring staff to fill all the holes that exist in the private sector. And one of the many reasons we wouldn't do that is if we were to hire them publicly to fill in, we would destabilize what staffing there is out there. So unless we imagined a world without a provider network, which I can't, over 93% of our services are provided in the private sector. That would be hard. We are working though. So we're involved with the Governor's Workforce Council. We're involved with Department of Labor and several other entities that are trying to help increase and broaden the pipeline to bring staff into wanting to work in the field, and then potentially looking at credentialing them in the field to try and make movement throughout the industry a little easier. But we're not alone. The workforce crisis we're facing, I mean, I'm sure you see it, Kevin, as well. I don't drive by a store in town, whether it's a gas station, a restaurant, a tailor, the auto shops, everyone has help wanted up. And right now there are more jobs than there are people. Believe it or not, Connecticut is in a little bit better shape than some other states. My colleagues that I talked to last week from Missouri says that in Missouri, there's 2 jobs for every eligible worker. And I think we're only around like 1.2 or 1.3 jobs per person. So believe it or not, we're doing better than some others. But the workforce crisis is real. And we are hoping that after the election, things calm down, that we'll be able to really put together some strategies to help support the private providers with the workforce crisis. We've been working on it in the background, and hopefully in the next few weeks, we'll be able to look towards a staffing resource that'll be dedicated to helping providers with the workforce crisis. Part of the ARPA work for families that self-hire is to increase access to individuals wanting to work on a for-hire basis, and potentially to create some relief for backup staffing as well for people who find themselves in that situation. If I danced around the answer to your question, Kevin, it was unintentional. I don't know if I answered it or not, but I'd be happy to follow up if I didn't.
No, that was a good answer. Appreciate it. And I can, if there happen to be any resources you could share in the chat regarding the self-hire option, I'd be interested in hearing more about that.
Yeah, so we will, we have access to your name and email, so we will have regional staff follow up with you directly, in addition to dropping something about self-determination in the chat. But Denise Palladino is the director of self-determination in the South region, and I'm sure that Cress, who was on the call earlier and introduced himself, can work with her to make sure you get the pertinent information.
Thank you.
Commissioner, I did see that Brian Gresco kindly put some information on customized employment in the chat with a link to that. But beyond that one comment in the chat, I do not see any additional questions. For those of you out watching along, if you have any questions, feel free to raise your hand or to put something in the chat. I see Win Everts has raised his hand.
Go ahead, Win.
Hi, everybody. Thank you for taking my question. With customized employment being sort of rolled out, how is that going to affect families' budgets if they want to participate in that? And will families still, if they're currently supported in a DSO, get some DSO hours? How's that going to work?
I can answer that. We have ARPA funding available that aligns with the customized employment support, so it doesn't impact the annual budget at all. The person maintains their annual budget, and then the funding for the customized employment is available through one-time funding, and so there's no impact on the annualized budget. They'll still have those funds available to them.
Thank you very much.
Up next, I believe we have Kate Johnson.
Where'd you go?
Kate, you just need to unmute yourself. That's all.
Yep, that's what I forgot to do. Good afternoon. Can you hear me? Good. You've been talking a little bit about the ARPA funding, and that's really where I was curious as to where we were going with that, other than the assistive technology, specific to families and individuals. Is there any, I guess I'm wondering what the biggest initiative there would be?
Wow. So there's a lot of initiatives going on. I guess it matters on the types of supports you receive and your areas of interest, because certainly the technology, broadening the assisted, the supported housing initiatives may be important to some. The staff stability may be important to some. The reinventing rewarding work website may be important to some. And that when I was speaking to the gentleman whose name isn't on the screen right now, who was asking the question on behalf of his son, redoing that website is one of the initiatives for people who self-hire, I think, or use agency with choice would be a pretty big initiative. We also have work going on around communications, which I think to some families will be really helpful. And we'll be announcing someone to help us communicate a lot of the work going on in ARPA, as well as just improving our overall. We started the meeting, someone talked about our overall communication, and we have some news that'll be coming forward on that pretty soon too. Elisa, given where the work that you've been doing and where you sit, what would you say is, from restating Kate's question, what's the big splash for individuals and families in the ARPA?
I think you touched on a lot of them. I think the system transformation is going to have an impact for individuals and families as well, because I think we're focusing on expanding the array of options that are available. And one of the initiatives is to expand supportive housing. That I think is going to have an impact. We're looking at supportive housing and broadening that so that more people in different areas of the state will have access to supportive housing. I think we're looking at ways to make employment more accessible to people. So depending, I think you put it well, Commissioner, depending on what your interest is, there's likely something within an ARPA initiative that may apply to it. It's pretty expansive.
And Kevin, will you pop a link into all the ARPA updates portion of the website when you get a chance?
Yeah, and I just want to add in with what Elisa just talked about, is that what I'm just going to put in right now is that we specifically have a ARPA family, individual and family engagement committee And I just put that direct link in the chat. And they have videos. Their committee is ongoing right now. They're public meetings, so you can watch them. You can't necessarily participate as a member of public, but you can watch them. In some past videos, they've had presenters, DDS staff that have gone through and explained each initiative from an individual and family perspective. So it might be something that'd be worthwhile for you to check out as well.
Okay, thank you.
Up next, we have Robin. Robin, if you would just unmute yourself and you may ask your question.
Hi, yes, thanks. So I'm back to Kevin's question about private hire. So back during COVID, when the day programs were shutting down, my daughter lives in a group home. When the day programs were shutting down and the choice was she needed to just sit in her group home all day, I had asked if there was a way for me to private hire somebody, and I had somebody lined up who used to work with her to take her during the time when the day program would have normally been in place. But the funding wasn't there because the day program is so much less expensive than a private hire would be. That person was going to take her and have her do some work with her and take her and teach her some job skills, but it was not possible to do that. So there was no flexibility. She's in a group home. She's stuck in a day program. If the day program doesn't have staff, there's no way I can pull her out and have enough money to fund her for all of the hours that she would need to be covered. And my understanding about the ARPA is that it's kind of a pilot program. It's just a limited number of people that will be able to be serviced. Is that correct?
Well, you covered a lot of ground there, so I want to unpack this carefully. The first thing I'll tell you is that ARPA isn't necessarily just pilot money. It is temporary money given to the state to try and target and transform. What the feds asked for was that we put in proposals that would be considered transformative, as this is basically once in a lifetime kind of funding that we may get from the feds. So in that regard, it's time limited, and it may only impact certain portions of the population, which you may consider a pilot. And there may be some smaller scale things we do that are pilot-like, but it isn't intended necessarily just to be piloting. We are using the money over a multi-year period to try and demonstrate that some of the things we're talking about will be long-term good for everybody involved. So at one of the tables, we're talking about incentivizing getting people from their current living situation to a different living situation in hopes that one, it'll incentivize providers, and two, that it'll free up resources for people on the wait list. So when we talk about ARPA and pilot, there's definitely some things that are piloty in it, but it hopefully will really impact many people in the system and not just a small number as we play this out over a couple of years. To your question about hiring during the pandemic and for hiring during the pandemic, and I don't know what went wrong in that specific situation, probably because I don't have enough details, but going forward, there are ways that you can self-direct day services. It is hard with the funding to have access to a provider and self-direct simultaneously, because the provider needs to know when people are coming and when they're going and what day they'll be supporting people. And we also don't have enough money to give everybody in the system one-to-one supports. So we determine those on an individual basis. But what I would be happy to do, Robin, is to try and follow up with you directly. One, to try and understand a little better what went wrong when you weren't able to direct some of your supports during the height of the pandemic, and two, to better understand the frustrations you're feeling now and see if we are hoping to become a system that is flexible and responsive. And so if you are finding us not to be flexible and responsive, it would be really interesting to hear more about why and what it is we might do that would change that.
That would be great. Thank you.
You are welcome.
Commissioner, that wraps up the hands we currently have raised, and I don't see anything else in the group chat. So folks, if you have any remaining questions, please feel free to raise your hand or put it in the chat. I see Win is raising his actual hand.
I win.
Sorry, I can't find the button so easily. I'm not very good with these bifocals. What does the process timeline look like for the transformation? When will people begin to have to be making choices?
Yeah.
Do all the choices go through a case manager? How's it going to work? And
So in total, we have 3 years to spend the ARPA funding. So I think through 2024. Some of the funding is already out there and is already hopefully making a difference with regards to certain aspects of the service system. But I don't want to misspeak on what's already been awarded and what hasn't. But I can follow up and find out and share back with this group. In terms of timelines, Elisa, I don't know if you have any idea on some of the more impactful things in terms of changing the system, and when we'll get past the group meeting stage and the implementation stage.
So I do. The groups have been meeting, incentives have been agreed upon. I think it's being looked at as a two-pronged process. So we have some providers that are ready to go. They've been thinking about this. They have some plans that are underway. I think I got the first proposal probably the day after we put out the notice around the ARPA funds. So in those cases, you may see things start to happen right away. Some things are already in process. Some providers may need a little bit more support. We are engaged with a consulting firm that will help with those transformation plans. And so for those providers who may need a little bit more support to conceptualize what that transformation would look like, there will be that support will be available. And so that I think will be staggered, not too far down the line, but not immediately. We're just engaged with them now, and they're gathering information about our service system.
Thank you, Elisa. Was that responsive, Win?
yes, no, perfect.
Great.
Thank you.
You got it. Any questions from anybody else tonight? While you're thinking of them, the recordings of these meetings, the updates from the ARPA meetings, the recordings made previous to these meetings, summary documents, we'll be looking to share all of this on the website, as well as eventually have an email list for people who wish to get information sent directly to them instead of having to go look for it. And we're close on that. That was feedback from last year's some of the feedback from last year's meeting that we hope to have fully implemented before the first of the year. I'm being bold, Kevin. I said the first of the year.
Yeah, I think we can do that.
Good. Any other questions for tonight? All right, having heard none, doesn't mean that your opportunity to ask questions or be involved is over. One, depending on how things go, we may have more rounds of these types of informational sessions. Two, you can email anybody at the state to get your question asked or your point made. If you're emailing me directly, I read all that as do my staff. So there's a number of us on the call. You can certainly go through Kevin and Joe who helped you with registration. And to keep on keeping on. And I appreciate, as I said, we have some advocacy organizations on tonight. For those who didn't attend the meeting, I know that our partners are at the ARC and at CT Family Support Network continue to make people aware that we're having these conversations and provide updates. And we appreciate you attending and listening on behalf of those who aren't able to attend tonight and helping us spread the word. Much appreciated. And with that, I wish you all a lovely evening. Take care.
Thank you.
Thank you.
Thank you.